Good morning, all of you. Today we are at Medical Expo India, and
Thank you, sir. Thank you very much. My name is Pritam Kumawat, and I'm one of the founder of Sanskritech Smart Solutions Private Limited. So we are basically a health tech company and trying to create an easy access for basic healthcare at affordable cost. So we have our solution called Swayam. So basically, it's a comprehensive solution for preventive diagnostic, end-to-end telemedicine solutions, and at the same time, data analytics can be done with the dashboards.
so this is a small introduction about the company and the person. You just see so how many the visitors come across the stall over here. So this is the first aid just inaugural by Honorable Deputy Chief Minister's wife today itself. So I have few questions
Sure,
about
sure,
your
please.
technology. What is the current scenario of the size and the of your market?
So basically, I'll give you just a brief why we created this. Because if you see, we have best of technologies, best of doctors available in India, but still access to basic healthcare is a missing link.
Right.
Whether you go to rural side or urban side, we are still the problem is the delay in diagnosis.
True.
And there are many reasons: not having enough infrastructure, doctors or medical professional, and even the awareness. So that's the reason we created this, and this is the potential market size is very huge because there is a genuine need for these kind of solutions, and that is what we are trying to do with this Swayam.
So what the reason behind the name like the Swaram? What the meaning
Yeah,
of that?
so
The
when
word
we
Swaram?
actually created this product, we really wanted to make sure that every person who is staying in a village and who is not even educated, they should be able to remember this, because our idea is not to sell any product. Basically, it's creating a culture, healthcare culture, where regular screening should be a daily part of the routine. That's the whole idea. So that's where the Swayam, because Swayam is a Sanskrit name, and it also reflects the concept like you can do things on your own and take the control of your health on your own.
Right, and as I see in your the logo of MyLab, so how you can associate with MyLab?
So MyLab is now we are part of a MyLab group. Now MyLab is one of the biggest company in molecular diagnostic and also the manufacturer of COVID RT-PCR kits. So now we are a subsidiary company of MyLab Solutions.
Tell us about some kind of clients who are you dealing with right now, and where all boundaries you are working.
Sure. So basically, installation of these machines are happening in government, where rural health centers, primary healthcare centers, and
Yes.
not only government, because wherever there are humans, human screening is required. So also in factories, CSR, there are a lot of CSR players who are supporting NGOs to take this technology at grassroots level, and industries, corporates, where most of the employees and laborers are working, and they also need regular health screening. And definitely we are also tying up with many doctors and hospitals so that they can also provide early diagnosis for their patients.
So do you have any CSR fund as well?
Yeah, we do get CSR funds. So we have basically foundations who get funding, and we give them the machines and the complete healthcare support so that they can execute the project at grassroots level.
So as you had mentioned, sir, you are a tech-based company. So nowadays, telemedicine concept is very emerging concept.
Right.
So every remote areas where the diagnostics and the doctors are not been available. So how you can give them facilities?
Yeah, so as I said, like this is a very comprehensive solution. So this has everything inbuilt. So one thing is preventive diagnostic. So all the tests can be done with the finger pricking method by understanding the challenges at rural places, because we don't get trained manpower.
Right.
So any person with a basic paramedic training and computer knowledge, he will be able to operate the machine. Now the same platform has a telemedicine facility also. In case of any severe issues, a person can connect with the doctor. We are also into services, so we can give a complete doctor backup to the grassroots level. If they want to consult the specialists who are sitting in cities, we can provide them. And teleconsultation platform is very easy and simple, and which can be done with multiple cameras also,
Right.
with the instant prescription facility.
So do you have any panels or any group of doctors?
Yes, we do
those who
have.
are-
There are many specialists who are on board, and we also have local doctors. For example, people who are in Uttar Pradesh or people who are in South India. I mean, they want to connect with the doctors who are locally available.
Mhm.
So we have state-wise panel of doctors who can communicate with them in a local language also.
So at present, how many states you are covered?
So right now we are available in almost 13 to 14 states, and maybe in a month or two will be there. Every month we are adding states. So we are working with the state government as well as central government and many private players also in every state.
So sir, as I am, belongs to Uttarakhand, the states of Himalaya.
So
So do you
yeah,
have
yeah,
any,
yeah. So we have,
base-
in fact, we started our first installation in Uttarkashi.
Oh, great.
And very soon Dehradun DG office, they are also in a process of, so I'm sure very soon you will get at least in every CHC, PHC in Uttarakhand also.
Right. So moreover, your focus is on PHCs.
Yes, in government, because see, ultimately, fortunately, government has created that infrastructure,
Yes,
but
correct.
only the problem was with the execution.
Mhm.
And with this kind of a solution, we can empower primary health centers, which will help doctors to cater services to their local citizens.
So how long you have been in this industry, sir?
Yeah, so we are into healthcare since last almost a decade, and particularly on this, we are doing this since last 6 years. A complete R&D, we have a complete in-house R&D and development team for this. Become very important role now. Everybody is concerned about their immunity and health status. So the good part is people are now accepting preventive diagnostic. They are taking it very seriously. So I'm sure now everybody is, whether they are institutions or government or any private player, they are now welcoming these kind of technologies, so that people can have that easy access for basic healthcare.
All right, now our prime minister's focus is also in PPP
Yes,
model.
so
Their dream is to work.
right. So
PPP.
we are working on that model also. So we are actually fulfilling their vision basically. If you see Ayushman Bharat Digital Mission, so it's a digitized completely healthcare solution which can complement their own system, and it is as per the ABDM guidelines only. So we have made every device or technology or software as per their guidelines.
Thanks for giving your time, sir. And I wish for your multiple growth in this segment, as you already work with the government as well as in a private. So thank you for your time, sir. And
We look forward. In fact, it is very important, to have a people like you in the society, so that these messages can be conveyed to
Definitely,
the
sir.
right people. And I'm very thankful to you. In
Thank
fact.
you so much, sir.
Thank you
Thanks
so
for
much.
giving
Thank
your
you.
time for Modern Medi Health.
Thank you.
Thank you, sir.
Very much.